So, unaccompanied homeless children are children under 18 who are unaccompanied by a parent or guardian. So that means they don't have effective guardianship, they're not in the custody of a parent or guardian, and so they experience homelessness alone. And homelessness for them can include rough sleeping, staying in crisis accommodation, but predominantly is most likely to be couch surfing with family, friends, and acquaintances. The children and young people who participated in my research told life histories that were really peppered with traumatic experiences. So this could include early childhood experience of abuse and neglect, which then in the context of homelessness was compounded by experiences of physical and sexual assault, intimate partner violence in their teen relationships, and exposure to all kinds of traumatic incidents, other people's violence, other people's self-harm, and so on. So we're really seeing this compounded trajectory of adversity that just does not let up in these kids' lives. So this means we know that early on in their lives, children are likely to be visible in that school environment. So it's the best opportunity to identify early where children might be displaying symptoms of distress, of emerging mental health issues, and other physical health and hygiene issues as well, which can all be indicators that something's not right at home, or indeed that children have already started to leave that home environment and are experiencing homelessness, potentially couch surfing with family and friends. So usually the focus for social work provision is in high schools and colleges, and yet we know that early intervention with these children could actually prevent these trajectories into and through homelessness. So a key recommendation of this current work is a real investment in social work capacity in primary schools, where it can make the most difference to children early on in their lives. It was really clear in my interviews with professionals around the state that there's a distinct mismatch between the kinds of mental ill health and service need that unaccompanied homeless children present and what's available in terms of mental health care. So that mismatch between need and available services sets up quite an extraordinary struggle for a whole range of professionals around the state who are left holding children and young people who are in significant mental health distress and who need mental health care but are not able to access that care. The fact that they are unaccompanied by a parent or guardian, they may not have independent income, very unlikely to. So there's a whole issue here around the practicalities of knowing where to go, accessing a service, paying for a service. But then it also became very clear that the services available in Tasmania are simply not set up to work with this high risk group of young children who are alone, who are experiencing unstable housing. And that's what needs to change. Our state needs to step in as the adult in these children's lives and provide a mental health service that matches the complexity of need that unaccompanied homeless children present. It needs to take that service to those children who are not in a position to be able to independently access that service on their own. So really what professionals emphasised is a need for a complex mental health service with very significant capacity for outreach. It was really clear in my interviews with professionals around the state that mental health service provision alone is not the answer here. Collaborative care across a range of agencies and services is needed for this group. That includes age-appropriate supported accommodation, care coordination, as well as access to appropriate complex mental health care. We're at a unique point in Tasmania where we are starting to bring together the key agencies needed for a collaborative, coordinated response to unaccompanied homeless children. We need mental health services as part of that picture. We need a mental health skill set as part of the care that these children are receiving. As one young person said, we need a better, bigger, stronger response, and mental health services as part of that.